When climate disruptions turn rivers into raging torrents, the danger is evident. Disruptions on livelihoods. Yet beneath these disruptions lies a quieter, equally deadly crisis, one that steals the health, safety and futures of women and girls. Kasese district, located in southwestern Uganda along the mountain ranges of the Rwenzori, one of the most climate change affected areas of Uganda. Unpredictable rain now brings heavy flooding, flash floods, but sometimes it is droughts, landslides and heat waves. And yes, there is a hidden devastation that falls hardest on women and girls.
And this is because they cut off access to health facilities, they cut off the medical supply chains, they also interfere with the sources of livelihoods. And in that case, you find households are less prioritizing sexual and reproductive health issues. So in that event, you find that they are constrained and they cannot address the sexual and reproductive health needs of women and girls.
So that affects the most vulnerable people. And you know, the most vulnerable people are mostly children, they are mostly adolescents, young people, they are mostly women, they are mostly persons with disability. So that is how gender comes into the equation.
We had a mother who was being operated on in theater, and when the floods came, they had to just move the mother from the table when they are open, and they had to carry them to another facility when they are what? When they are still what? Open, which was a vivid example of what? Of the effects of what? Of these extreme weather events which are coming about due to climate change.
But Kasese district local authorities, together with partners, drafted and adopted a Climate Change Adaptation Plan, and unlike the typical climate-only strategies, the plan explicitly embeds gender-responsive pillars. The plan recognizes that climate resilience cannot be achieved unless women's sexual and reproductive health rights are protected.
Our focus is better. We have identified the subgroups that are vulnerable. Of course, we have also known that our people are generally resilient because they were able to identify activities that they think if they supported them, then they would become more resilient in the face of climate change. Yeah, so the district is now coordinating better. We are implementing better because we've known what to do.
The in-charge Chilembe Mines Hospital explains how women are more affected when a river Nyamwamba and other rivers around the mountains burst their banks.
So our maternity was destroyed by the floods that have some silting in the maternity, which affected us negatively in terms of offering productive health services. So the mothers who were able to access services easily from Chilembe Mines Hospital had to now move to some distance for the time being before the shifting to the nearby place, had moved a little bit further. And even during the time of the floods, they had to move to Kasese for the same health services, to receive antenatal services, delivery, and even family planning services. They had to go to a further place.
So they would travel to town, downtown, for a transport of at least 4,000 to reach those. They wouldn't get transport facilities, they would foot. So that thing would affect them very much. So when these people came, they even reached up the mountains to bring these health facilities there. People have been screened for cancer. People have been given many reproductive health supplements.
The change agents and especially women that have been established at different platforms of work are evidence of how adaptation plan is working for them.
Amundu kwanga spacing abana kusangwa ukarangiraho orusirwa mabiri osuri unautra bwana bolera
They teach us many things. They have even taught us child spacing. When the families are big, sometimes the women fail on what or whom to prioritize, including males and husbands.
Nikesi amabana ke chizibu chosi when the river floods narumangana to karo koramut
kambe tuka butu kuika hika ngahawa tu hano babitu irawe community radio nedio orusiru kabirwa mosuri
They have put in place early warning systems, counseling and mobile clinics. The community leaders announce on radio when there is a crisis, then we are alert, we plan adequately.
Rukaro mabiri sura na tukai kumakomeraho itwevose abataka itwa ikomeraho neko pamabere twetwe obuwati kisitotokeswa maka wetu ibatuletera obuwati change byalya itwa bitu naute ekambu yetu.
But after getting the awareness of how to mitigate climate, we were able to plant fast growing trees, for example, and this has helped our women not to go far to collect firewood. Sometimes they prune these trees. Like now we have the 1 year growing trees, 2 years, 3 years growing trees. And these trees are growing very fast. Like Musizi, you just get the branches, and these women are now able to get some firewood from nearby.
Dr. Tumuhere emphasizes that the number of women accessing medical facilities had greatly reduced due to disruptions in enabling infrastructure, but are now slowly picking up, even when there are gaps that need to be managed.
Because people still feared coming near the river, and maybe they thought the services actually were halted. But by now we are operating and people are increasing and the numbers are coming.
When it is a government program, like the WEP funding, we look at these women who are already engaged in activities that are mitigating the weather situation, the climate change effects. We support them because they are in the business of making sure they improve the situation, making it better than it was before.
The 10-year Climate Adaptation Plan, valued at 500 billion Ugandan shillings, earmarks a substantial budget for gender-responsive health, infrastructure and GBV response teams, but more needs to be done.
Specific activities which are focused on their empowerment, which are focused on building their capacity, but also supporting them to especially enhance their income. Because we have also realized that the most vulnerable are poor, so the issue of household income also needs to be addressed. So the plan is also focusing on that area.
The people who are affected by the floods, who are like living in the flood plains, this part now move to camps, which are now actually like a health hazard. That's why you have a lot of HIV in those camps, you have a lot of teenage pregnancies, a lot of health, actually a lot of issues to do with disease due to hygiene, a lot of maybe cholera coming in, a lot of diarrhea coming in because there are now people now in one area, hygiene is poor, and also have lots of malnutrition coming in due to what? To those effects. People are no longer having time to cultivate, and now depending on support from the partner, that is government and maybe UN, to supply them with food. So we have all that.
Policymakers, donors and community leaders must scale such models into every disaster risk plan, but especially climate change across the country.
The Kasese Climate Change Adaptation Plan proves that climate resilience is incomplete without integrating gender transformative approaches. When women are protected, families thrive.
From the rumbling waters of River Nyamwamba to soft, hopeful steps of women attending Kirembe Mines Hospital, Kasese teaches us that climate adaptation is not just about the environment, it's also about the people that live within the community. Climate adaptation is not just environment, it's about the safety, the well-being, the continuity of the community. For UBC News, I am Rose Buchirwa.